Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and we are continuing our journey on the Medicare New Handbook. Let's start with Section 3, page 57, Original Medicare. So, how does Original Medicare work? Original Medicare is one of your Medicare health coverage choices. You'll have Original Medicare unless you choose a Medicare Advantage plan or other type of Medicare health plan. Original Medicare includes two parts, which is Part A hospital insurance and Part B medical insurance. You generally have to pay a portion of the cost for each service Original Medicare covers. There's no limit to what you'll pay out of pocket in a year unless you have other coverage like Medigap, Medicaid, in California it's Medi-Cal, employer, retiree, or union coverage. Original Medicare. Can I get my health care from any doctor, other healthcare provider, or hospital? In most cases, yes. You could go to any Medicare enrolled doctor or other healthcare provider, hospital, or other facility that accepts Medicare patients anywhere in the U.S. Visit medicare.gov/care-compare to find and compare providers, hospitals, and facilities in your area. Does it cover prescription drugs? Part B doesn't cover most drugs, but there are some exceptions like immunosuppressive drugs, page 52, or drugs for pain and symptom management for hospice care, pages 26 to 27. Part B may also cover some infused and injected drugs given in a doctor's office and insulin used with a traditional pump. Go to pages 34, 44, and 47. You can add Medicare drug coverage Part B by joining a separate Medicare drug plan. Go to pages 79 to 90. Do I need to choose a primary care doctor? No. Do I have to get a referral to use a specialist? In most cases, no. Keep in mind, like labs and x-rays and things like that. The labs usually want you to get a referral or a work order from your doctor because they just don't want someone to come in and ask for a whole bunch of tests without really being sent by the doctor. Okay. So note, go to page 119 to 122 for definitions of blue words. Maybe I should, your primary care doctor is a doctor that is primarily in charge of your care, okay? Like that's a general practitioner. And then a referral is when your doctor tells you to go to a specialist, and typically those need to be approved. Okay. So let's go to page 58. Should I get a supplemental policy? You may already have Medicaid or employer retiree or union coverage that may pay costs that original Medicare doesn't. If not, you may want to buy a Medicare supplement insurance, Medigap policy if you're eligible. Go to pages 75 to 78. You could also check with your state medical assistance Medicaid office to see if you're eligible for Medicaid. What else do I need to know about Original Medicare? You generally pay a set amount for your health care deductible before Medicare begins to pay its share. Once Medicare pays its share, you pay a coinsurance or copayment for covered services and supplies. There are no yearly limit for what you pay out of pocket unless you have other insurance like Medigap, Medicaid, or employer retiree or union coverage. You usually pay a monthly premium for Part B. This premium may change each year. You generally don't need to file Medicare claims. Provider and suppliers must file your claims for the covered services and supplies you get. Let's kind of go over that again. You generally pay a set amount for your healthcare deductible. Okay, that definitely does go up or down every single year before Medicare begins to pay its share. For 2025, it's $257. Once Medicare pays its share, you pay a co-insurance or co-payment for covered services and supplies. Typically, it is a 20% co-insurance on Part B medical portion. Okay. There's no yearly limit for what you pay out of pocket. Okay, that's the biggest thing, right? Because you don't want to have unlimited cost in your healthcare if something catastrophic happens. But of course, if you do have Medigap, Medicaid, employer, retire, union coverage, and I want to add if you have, a Medicare Advantage plan, also there are caps to that. Okay. You usually pay a monthly premium for Part B. This premium does change every year, so it could go up or down. Of course, the trend is always up, but during COVID and after did go down, but then it did jump up again. Okay, you generally don't need to file Medicare claims. Providers and suppliers must file your claims for the covered services and supplies you get. Just notate on that, review your bills, right? You don't want to be paying for something you're not supposed to, or they billed an error, they had denied a claim because they put the wrong code, medical code. So things like that to watch out for. Okay, what do I pay? Your out-of-pocket costs in original Medicare depend on whether you have Part A and or B. Most people have both. Okay. Whether your doctor, other healthcare provider, or suppliers accepts assignment, go to page 59 to 60. Sometimes people don't have both Part A and B. Sometimes when you have not worked here for more than 5 years, you aren't issued a Part A, but there are ways to get that. Either pay that premium. If you're on Medicaid/Medi-Cal, they could pay that for you, but it is a process, and reach out to us and we could help you with that. The type of healthcare you need and how often you need it. Okay. If you choose to get services or supplies Medicare doesn't cover, if so, you pay all costs unless you have other insurance that covers them. Biggest thing I would always ask if it's covered by Medicare, because sometimes there's like labs that aren't covered, different vendors that might. So just be careful with that and make sure it's covered. Whether you have other health insurance that works with Medicare, go to page 21. Okay. Whether you have full Medicaid coverage or get help from your state to pay your Medicare costs through Medicare Savings Program, go to page 91 to 92. Sometimes people on Medicaid, Medi-Cal, they're like, why do I need to get on Medicare? Medicare definitely opens more doors to doctors and specialists and even hospitals and facilities that don't want to just take like Medicaid or Medi-Cal. And then you just never know. Things are changing in a rapid pace. Medicaid and Medi-Cal qualifications are changing, have been changing, sometimes even depending on the administration. So I would definitely still get Medicare even if you're on Medicaid. And full Medicaid, which pays for your premiums and everything in your healthcare. Oh, which this one says whether you have full Medicaid coverage or get help from your state to pay your Medicare costs through a Medicare Savings Program, go to page 91 to 92. Whether you have a Medicare supplement insurance, which is sometimes called Medigap, whether you and your doctor or other healthcare provider sign a private contract, go to page 60. How do I know what Medicare paid? If you have original Medicare, you'll get a Medicare summary notice that lists all the services billed to Medicare. That MSN isn't a bill. It shows that Medicare paid, what Medicare paid, and what you may owe the provider. Review your MSNs to be sure you got all the services, supplies, or equipment listed. If you disagree with Medicare's decision to cover a service, the MSN will tell you how to appeal. Go to page 99 for information on how to file an appeal. I stress this again, reviewing your bills, making sure it's correct so you're not paying more or less than you have to is something that is important. You'll get this notice in the mail every 4 months unless you sign up to get it electronically. Okay. So we are on page 59. If you need to change your Medicare address on your MSN, visit ssa.gov/mycontact. If you get Railroad Retirement Board RRB benefits, call the RRB at 877-772-5772. Okay. Your MSN will tell you if you're enrolled in the Qualified Medicare Beneficiary QMB program. If you're in the QMB program, Medicare providers aren't allowed to bill you for Medicare Part A and or Part B deductibles, coinsurance, or co-payments. Some cases you may be billed a small co-payment through Medicaid if one applies. For more information about QMB and steps to take it, if a provider bills you for these costs, go to page 91. So for the Qualified Medicare Beneficiary Program, I would say there are tiers on this that are full Medicaid. So there's tiers, so understanding that and learning that does help with your premiums, your copays, your coinsurance, and your drug costs. Okay, important, get your Medicare summary notices electronically. Of course, we're trying to save trees, right? Better for the environment. But I get it because sometimes reading a piece of paper is better than getting electronically. But they are definitely trying to persuade you to go get it electronically. Get your Medicare summary notice electronically. Visit Medicare.gov to log into or create your secure Medicare account. If you sign up for electronic MSNs, we'll send you an email each month when they're available in your Medicare account. Instead of paper copies in the mail, as of late 2024, people who signed up for the electronic MSNs helped save the Medicare program close to $42 million. Okay, so that's definitely a big one. The fraud, waste, and abuse, that's not fraud, waste, and abuse, but look how much it would save everyone. 42 million to get no paper copies. Keep that in mind. Okay. You have options for how you get your Medicare claims information. Okay, you could check your MSN for claims information. You could access your claims in your account on Medicare.gov and share this information with doctors, pharmacies, and others by visiting Check My Claims. You can access your claims through Medicare's connected apps. Connected apps are Medicare approved applications or websites that a third party, not Medicare, creates. Okay, let me repeat that. You could access your claims through Medicare connected apps. Connected apps are Medicare approved applications or websites that a third party, not Medicare, creates. When you connect to an app and log in with your Medicare.gov account information, you could use the app services without manually entering your health information. You could use the app services without manually entering your health information. Okay, said that already. These third parties could also access your Medicare data if you choose to share it with them. It's always your choice. If you want to connect or stay connected to a third-party app, go to page 109. As technology and scams are just more rampant, just be careful that it is a vendor, third party that is legitimate. What's assignment? Assignment means that your doctor, provider, or supplier agrees or is required by law to accept the Medicare approved amount as full payment for covered services. Most doctors, providers, and suppliers accept assignment, but always check to make sure what yours does. If your doctor, provider, supplier accepts assignment, your out-of-pocket costs may be less, okay? They agree to charge you only the Medicare deductible and coinsurance amounts, and usually wait for Medicare to pay its share before asking to pay your share. Sometimes there is definitely a lag time from like the claims, from them billing you. It's just the nature of the beast that sometimes it takes a long time to file these claims. Okay. They have to submit your claim directly to Medicare and can't charge you for submitting the claim. Okay. Never seen that happen, but just in case. Some providers haven't agreed and aren't required by law to accept assignment for all Medicare covered services, but they can still choose to accept assignment for individual services. The providers who haven't agreed to accept assignment for all services are called non-participating. You might have to pay for their services if they don't accept assignment for the care they provide to you. Here's what happens if your doctor, provider, supplier doesn't accept assignment. Okay, first, you might have to pay the entire charge at the time of service. Your doctor, provider, supplier is supposed to submit a claim to Medicare for any Medicare covered services they provide you. If they don't submit the Medicare claim once you ask them to, call 1-800-MEDICARE. That's 1-800-633-4227. Okay. They could charge you more than the Medicare approved amount. In many cases, the charge can't be more than 15% above the Medicare approved amount for the non-participating healthcare providers. The amount is called the limiting charge. So just be careful on this. I've had clients, as example, have gone to the eyeglass or the optometrist, and they charge them upfront, and then they get billed again. And so things like that, either one, the office or the place provider you went to doesn't know how to bill, they did an error, or even at times they know that they're just overbilling you and they don't think you're going to ask or care about it to get a refund. So be smart, just be careful on that. Okay. Compare. If you have original Medicare, you can use any provider you want that takes Medicare anywhere in the US. And if you're in a Medicare Advantage plan, in most cases, you'll need to use doctor and other providers who are in the plan's network. Find out if someone accepts assignment or participates in Medicare, medicare.gov/care-compare. Find out if a medical equipment supplier accepts assignments, medicare.gov slash medical equipment suppliers. You could also call your state health insurance assistant program, SHIP, to get free help with these topics. Go to page 114 to 117 for the phone number for your local SHIP. What I've been hearing about SHIP, though, who knows if that might go away based on just budgets and cutting that out. So I'm not 100% sure on that. I did want to go back and talk about Medicare, but let's just go forward, and then after this I'll talk about it in a little bit more detail. Okay, what if I want to use a provider who opts out of Medicare? Certain doctors and other healthcare providers who don't want to work with the Medicare program may opt out of Medicare. Medicare doesn't pay for any covered items or services you get from an opt-out doctor or other provider, except in the case of an emergency or urgent need. If you still want to use an opt-out provider, you and your provider can set up payment terms that you both agree on through a private contract. A doctor or other healthcare provider who chooses to opt out must do so for 2 years. If the choice renews automatically every 2 years unless a provider requests not to renew their opt-out status. If you're unsure if a provider has opted out of Medicare, check with them so you'll know ahead of time if you need to pay them out of your pocket. Pages 10 to 14 for an overview of your Medicare options. So I do want to have some commentary in regards to original Medicare, right? I definitely don't want anyone to just be on original Medicare, because even when someone says, I am 100% healthy, I don't go to the doctor, I don't go to a specialist, I don't take prescription drugs, you just never know. And as you are growing older, something catastrophic may happen. And then when something catastrophic happens, the bills could definitely pile up. And, you hear about medical bankruptcy, um, and just you're already dealing with your health concerns and conditions. And to top it off with another, financial burden headache, is not good. Okay. Of course, you're going to have Medicaid, Medi-Cal that could help you pay if you're, like mentioned, on a group health plan, retiree, union. That will definitely work. But if you don't have that, or definitely want to compare those options, there is the Medicare Supplement Plan, which is the Medigap plan. It supplements your original Medicare and covers what original Medicare is making you pay, right? So that's a great option if you do not want to replace Medicare. Okay, if you're okay replacing Medicare, if you want those all-in-one packages so you're not worrying about paying your Medicare supplement plan, your drug plan, your dental, your vision, then the Medicare Advantage plan might be a good option, okay? But of course, it varies from every individual. And I know some seniors are very biased on one or another based on their individual experience or preference. But like I say, it is good to listen to your friends, your family, your relatives that are on Medicare, right? But not all things are equal. You are not equal to them, right? Your health concerns, your prescription drugs, your preference, your budget, they all are going to be very different. That's why it's great to talk to a licensed independent insurance agent to help you with that. If you have any questions, please feel free to call us. We're here just to be a resource to the community. Well, today I'm ending the call on this. You have a call. It's not really a call, right? It's a show. You have a wonderful day, and I will see you next time. Take care.